Rolling. Hello, good morning.
Hello.
Today, we are with our orthodoc. This is Dr. Francisco Roura. He's also my rib guy. Okay, we do the chondrotomy together. But today, it's a different scenario because we're going to treat osteoarthritis. Okay, so, bakit siya nandito? Samantalang ortho, tapos thwt. So, ang gagawin natin today, what we're going to do today is SVF, stromal vascular fractions. We're going to harvest your stem cells from the fat to be injected into your osteoarthritic joints. Right? Where is it? Like knees,
hips, ankle, shoulder, or any joint.
Okay, yon. So, this is called part of the Regenerative Orthobiologics
Treatment.
Orthobiologic. Ortho, bones, biologic, their own body. So, it is an autologous SVF or stem cell therapy. Okay. So, Doc, ano ba mga pasyente natin sa osteoarthritis? Of course, as you say, osteoarthritis, medyo may edad na sila. Right? What are options for treatment, Doc? Ano ba mga signs and symptoms muna na nararamdaman?
Siyempre, osteoarthritis, it encompasses a wide array of conditions. So, but mostly, ang tinitreat natin for this kind of SVF treatment or orthobiologics are those degenerative type. They say degenerative, usually, it degenerates from the word degenerate.
Age-related.
Age-related. And usually, when you have this degenerative type, yun na yun eh. So, wala siyang direct treatment for that. Walang treatment. All the medications, the one that you take are temporary. They will give you pain-free, but it will not last. So, babalik at babalik siya. Ganyan ang degenerative. So, kahit na isang sakong gamot ang inumin mo dyan, wala yan, nandiyan pa rin siya. So, basically, ganun ang degenerative osteoarthritis. So, dead end siya. Wala siya, nandun na siya. So, what we usually do is to make our patients more comfortable, more functional, nagagawa nila ang gusto nilang gawin, and at the same time, may enjoy nila yung buhay nila, yung quality of life. So, yun yung aming focus for, at the moment, for the treatment of osteoarthritis. But now, kasi by culture kasi, or by nature, by human nature, we don't want major surgery. Kasi ang pinaka-treatment for end-stage osteoarthritis is replacement. That's the standard treatment for end-stage osteoarthritis. Yung mga severe type, talagang cartilage or yung lining or yung cushioning of the bone, talagang wala na. Sabi nga nila sa mga layman, bone to bone. Or nagdidikit na yung buto. So literally, ganun siya. So pag ganun na siya, compromise na yung function ng joints mo. So nandiyan na yan. Yung severe pain, stiffness, hindi ka makagawa, yung loss of function. Yun yung pinaka-importante, hindi mo magawa lahat yung gusto mo sa buhay. So, you are confined on a closed space or a limited space na lang. So, limited yung activity mo. So, that's the time na papasok na yung surgery pag severe na. But nowadays, sabi ko nga, ang culture natin, we don't want surgery right away. So, we want to maximize all those less invasive type of treatment o yung mga hindi siya kinakailangan ng operasyon, ng major operation. So dito na pumapasok yung ganitong treatment. So basically, kapag maaga, mga mild, syempre, nandiyan pa yung
pain lang.
Oo, pain. Number one dyan, kung talagang heavy yung pasyente, buwasan mo yung weight para to unload yung burden ng knee niya. So it will help a lot. Weight loss. So, mga medyo chabilita dyan, chabilitos. So, may pagkakataon pang bawasan yung paghihirap ng tuhod natin. Diet lang yan.
Reduce the strain.
Yes. Now, secondly, so aside from the weight loss, actually siya yung number one sa akin eh. Secondly, number two, ito kaya nyo rin to eh. So, yung lifestyle change nyo. So, kung kayo yung dating sedentary, nakaupo lang, bahay, trabaho, it's about time to move a lot. Kasi movement actually enhances healthiness of the joints. Yung cartilage, gusto niyan. The more you give the load to the knee, mas healthy siya. Nag-focus siya ng lubrication, nagre-respond yung cartilage to become more strong, nagiging mas matatag sila. So, nagiging healthy sila in a sense. So, the more movement, the better. So, yung movement, depende sa stage nyo. Kung kaya nyo pa, mga mild, kaya nyo pang takbo konti, walking, takbo, pwede. But the safest, kapag medyo advanced na, usually, mga swimming yan, mga hydro exercises, biking, ganda, hindi siya masyadong naloload.
Hindi
pwede mo lang siyang itimplahin yung resistance, depende sa lakas ng tuhod mo. So, yan, the best exercises, swimming and biking. Stationary bike is the one I advocate kasi risky pa ma-fall kapag yung nagbabike talaga sa subdivision niyo or sa road. May risk. So, stationary bike or the simple restorator sa mga severe type ng arthritis na hindi na talaga makalakas. Simple restorator, yung nagkakaroon lang ng movement. Inuupuan lang. That napakagandang exercise for the talagang compromised joint na. Talagang hindi na niya ma-function. Gawin lang yon daily on basis or libangan, mas okay. Kasi it won't give any injury to your knee. So, magpo-promote pa niya yung healthiness niya. So, yon. Thirdly, maraming supplements na available sa market. We say supplements, not guaranteed as well. So, lang siya. You can take it, you may opt to take it, you may not opt to take it. But there are studies on a certain medicine, yung glucosamine, may positive effect siya sa joints. Yung collagen, questionable. Chondroitin, questionable. T3, questionable. Fish oil, questionable din. So, but you can take those supplements as just like food. Ganun lang siya, parang pagkain lang. Okay lang, there's no harm in taking it. And then, fourth, mga injections, medyo nagiging aggressive na treatment. So, yung fourth type is mga injections. Like very popular dyan, steroids. But I don't advocate steroids unless yung patient is so old na and hindi sila nagko-concentrate of surgery later on na hindi na nilalagaan. Pwede mo siya ibigay at a certain frequency. Hindi siya pwedeng dalasan. So, your doctor knows. Kaalam ng doctor ito. So, for acute pain, gusto mo lang siyang mag-travel. May travel siya. So, pwede mong lagyan para maka-enjoy siya. Now, second injection, yung viscose supplementation. Yung para siyang gel. It literally lubricant, yung hyaluronic acid. So, injectable to, alam din ng doctor niyo, especially the orthopedic, rheumatologist, or rehab. So, ito, medyo matagal na siya, long being used, but may proven effect na siya. So, hyaluronic acid.
Nawalan tayo ng parang cushion.
Cushion. And the quality of the synovial fluid or yung oil natin sa tuhod natin is, yung property niya is less viscous. So, nagiging hindi niya ma-function yung lubrication. So, you supplement it with artificial or synthetic type of lubrication. And then, third injection, dito na yung mga orthobiologics. Yung orthobiologics mo, popular dito nowadays, the PRP, yung platelet-rich plasma. So, yung platelet-rich plasma, na-harvest to sa peripheral blood natin, sa dugo mismo. So, simple lang yung procedure. It's like getting a blood extraction for your blood chemistries. Ganun lang siya. So, you just get 40 cc, maganyan blood. And then you process it. There's a certain process. And then you harvest the portion of the blood that is rich with a certain protein, specialized protein, mga cytokines, ganun. It has a healing effect. It has anti-inflammatory effect. It has immunomodulatory effect as well. So, pero sabihin natin matabang siya ng konti. Pero, better than nothing. So, you can do it as frequent as you want. It has no side effect actually. Wala siyang side effect except for mild swelling. And it comes from you, so there's no reaction. Walang reaction ako nakita sa pasyente.
Wala rin siya overdose.
Walang overdose. You can, the more you do it, the better.
Yeah.
Siyempre, pera, mahal. Mahal siya. Okay? And then pangilan ba yun?
Fourth.
Fourth.
Number 5 na ayaw.
Pang 4. Usually, I modify the the injection. I combine the PRP and the hyaluronic. So, may mga studies din ganyan. So, ito usually ang ginagawa ko combination na hyaluronic and PRP as a maintenance. May say as a maintenance, as I mentioned before, degenerative kasi there's no specific treatment. So you need to maintain at a certain level. So it won't progress up, but you maintain at a certain level of arthritic damage. So you just maintain it, so you have to maintain the treatment. So you cannot reverse. Impossible. If the doctor tells you that reverse, it will never happen. It will always be there. But we are just
preventing further progression.
Yes, we're modifying the course. So instead of going up, progressive, you just maintain it at a certain curve, maintain, even get better, but it never goes down, never goes to the normal state. So that's a real talk, real talk yan. Totoo yan. The facts of ortho. And then the last one, ito yung mga stem cell na, stem cell technology. Maraming klaseng stem cell. So, nandyan na yung micro-fragmented fat or the branded niya, magsasite na ako ng brand, yung lipogems. It's popular in the US because it's BFAD approved. The only, BFAD approved sa kanila.
FDA approved.
FDA approved. So, common niya, popular sa state, yung lipogems. It's a brand. But here, since it's very pricey, we just utilize the same principle. It's a generic type of lipogems. So yun yung ginagawa madalas din sa patient. So it's not 100% guaranteed as well. But patients would notice some minor changes, very gradual. It's not something like
it's not instant.
No instant effect. Mayroong iba nagkakaroon instant because of the anti-inflammatory effect niya. Pero most of the time, it's very gradual. It takes a lot of time, like 3 to 6 months.
Yes.
And then another stem cell, yung mga collagenase na nga, yung mga SVF mo, mga lecithin, yung Adistem, ayan, mga brand yan.
So we have the SVF.
The SVF, or stromal vascular fraction. This is more specific for the stem cell. Kasi dinadigest niya yung stem cells doon. Tinatanggal niya, right? Diba?
The mesenchymal stem cells.
Mesenchymal stem cells. So yun lang yung kukunin natin.
Yes.
So
but
specific
we harvest it from fat.
Yes.
That's why we do a mini lipo to get a certain volume of fat. We process it, okay, and then we isolate. We isolate the stem cells, not the fat itself, okay, but the stem cells in between the fat. It is called your mesenchymal stem cells. With the lipogems kasi and the other modality, nano-fat, it's the actual fat. The actual fat yung ginagamit natin. So, yung in between nun, kasama yung stem cells niya.
Parang shotgun siya.
Shotgun.
Ito kasi sniper to. Sniper to. It's a shotgun.
Yes, this one is specifically the stem cells in between the fat. So, we call it the stromal vascular fraction. So, we harvest it, we process, and then we re-inject into the joint itself or to the other areas that we actually need regeneration, and we also give for therapeutic.
Yeah.
Yes.
And then other sites where you can harvest the stem cells.
We also have bone
marrow
and
peripheral blood and cord.
Cord blood, yes.
Cord
blood or umbilical cord. But the one that, as Dr. Kim mentioned, the one that has high yield and very easily available is the fat.
So, merong
madami tayo.
May kayamanan sa taba.
Maraming function ng ating fat. So, there you go.
Okay, so aside from that, and then after the injection, yung na-discuss na ba ni Dr. Kim? Yung after the injection,
ano gagawin?
Wala na. Treatment lang tayo.
Treatment lang tayo.
After nun, ayun, yung last na nga. The last option would be replacement.
Yun na yun.
The standard treatment. Actually, iba, may recta dyan after ng mga supplementation. Rehab pala. I forgot to mention the rehab.
Okay.
The rehab has also parang, major role in the treatment. They maintain the function, the strength, the flexibility, the balance, any exercises that will benefit the knee they will give you the exercise, different exercises. So rehab also has an important role. After the, after the supplementation, that would be number 4, before the injection. So yeah, I forgot. Singit lang yun.
Singit lang. Okay.
Okay, what else?
There you go. I think we've already...
na-cover ko na yung osteoarthritis. Lahat.
Sobra. Sobrang, too much information na to.
Pero lahat na yan. Yan na.
Yan na. This is rundown in your osteoarthritis.
Yeah.
Okay, bye. Orthodoc. Dr. Francisco Roura.
Yeah. Okay.
Thank you.